So when patients come in for cataract surgery, it's a big decision they're making, and cataract surgery is not something that people know too much about. They have the gist of it, but it involves removing the natural lens of the eye, and in its place, we have to put in a new lens. When we do that, patients have an option of what lens to get. Nowadays, there's advanced technology lenses. There's a bunch of them out there, and each patient has a best lens for them. I find that there is no best lens. Each of them works with a different technology, and each of them has their pros and cons. So when you meet with your surgeon, it's a conversation that you have both ways. You're learning about your surgeon, and the surgeon is learning about the patient. And the lens choice really depends on what the patient does on a daily basis. Are they still working? Are they retired? What hobbies do they do? A big factor in it is their personality. So oftentimes I have a conversation with my patients and try to figure out what their personality type is. And the last thing is, what was their vision before cataract surgery? How were they seeing in their 20s and 30s? Were they wearing glasses correction? Did they get LASIK? And so all of this really sets the patient up for the best lens for them. So it's a consultation between the physician and the patient. As far as the lens technologies that we prefer, there's different types of advanced technology lenses. There are light adjustable lenses. That's basically the most premium and technologically advanced lenses out there. These lenses are great for patients that want a little bit of customizability to their lens implant, and they want to choose what vision they have afterward. It's also good for patients that have some sort of a corneal irregularity, such as post-LASIK ectasia, or just having had LASIK or even RK in the past. These eyes tend to have a post-operative refractive surprise, and so with the light adjustable lens, we can take care of that error that's left over by adjusting the lens with light. It's a non-invasive thing, and patients really do enjoy their vision, even if they've had LASIK. The process of it involves having to come back after surgery and getting your prescription checked, just like whenever you get a pair of glasses. The cool thing is we can build in that prescription into the lens, and that's your prescription for life. The light adjustable lens is fantastic. There are some drawbacks. The range of vision is not as good as a multifocal lens, so patients will oftentimes have to set one eye a little bit more nearsighted than the other. It's not quite monovision, but we call it mini monovision, and patients should know about that when picking that lens. Multifocal lenses are the most popular lenses that are implanted in the eyes in terms of advanced technology lenses. They give you full range of vision. They'll give you distance vision, computer vision, and near vision. So you'll be able to watch TV, work on your computer, and look at your phone in one breadth of view. These lenses are fantastic plug-and-play options. They work well in eyes that are healthy with normal corneas and normal retinas. They do degrade your vision if you don't have perfect eye health. These multifocal lenses are great, but patients do notice glare and halos at night when they're driving. Oftentimes patients neuroadapt to this, but sometimes it persists. And we have to figure out which patients are not good candidates for these lenses. There are anatomic issues like a large pupil that may exacerbate glare and halos. There's personality issues as well. If somebody is really detail-oriented, has worked their whole entire life in a profession that involves details, they are probably going to perceive the halos a little bit more than the average patient. Once again, it's the physician's job to figure that out. And also there are extended depth of focus lenses. These lenses are similar to multifocal lenses, but they don't provide as wide of a range of vision. These lenses are advantageous because they are simpler. They don't produce glare and halos as much as the multifocal lenses, but they also don't provide the near vision that the multifocal lenses provide. Oftentimes we can get around this by setting one eye a little bit closer than the other, so one eye will be more nearsighted. It's, again, mini monovision, and some patients don't like that. So that's our job to figure out. There are other lens options as well. Monofocal lenses are fantastic for some patients who have some eye pathology or don't mind wearing glasses afterward. Toric lenses fix your astigmatism and give you great distance vision, but don't offer any range of vision. So you have to wear glasses correction for anything up close. The good news is, since the astigmatism is fixed, your prescription will be a pair of reading glasses that you get over the counter. The basic lenses, the monofocal lenses, they don't fix astigmatism. So if you do have astigmatism, you'll have to wear a prescription pair of glasses for both distance and near vision. If you don't have astigmatism, the standard monofocal lens will be great for distance, but you'll have to wear some reading glasses up close.